This is Lottie and I just want to share my full breast lump story. I want to talk to you guys about my surgery and nangyari, why I have been on a hiatus, and I also want to do this video so I can help raise awareness on women's health because I know na lots of women go through the same thing that I just went through. No first week of July, I usually do mga weekly or monthly checks sa breasts ko. Kakapain ko sila and just to check for usual na mga lumps. Sanay na ako sa boobs ko na meron siyang medyo lumpy talaga siya. Nakapa ko yung first lump ko when I was 12 years old. I had that checked and it was okay naman daw, it's normal. Got checked before for 2 lumps naman sa right breast ko. Small lang din sila. So, it was nothing to worry about. So, i-adjust ko lang. So, I still do my mga lump checks every now and then. And then, the first week of July, chinek ko yung right boob ko. May nakapa akong malaki. So, I was alarmed kasi parang ganito yung size niya. Para siyang mini golf ball. Panic na agad ako. Kasi it was really big. I've never felt a lump in my breasts that big before. I'm sure hindi nyo mapipigilan going on the internet and doing research and then checking kung ano ba talaga to and all that. And you're gonna see the worst things. So, to ease my anxiety agad, nag-book ako ng teleconsult for that same day and then I told the doctor what was the problem. And the OB dun sa teleconsult told me na it could be a fibroadenoma or something na fibrocystic or a normal hormonal thing. But if it's big, I should really get that checked. So she insisted na I get an ultrasound. I reported back to her and she said na it does seem like yung ultrasound, it shows mga benign findings. I still opted to get it checked by an actual surgeon and an OB-GYN face-to-face. Unang kapanya pa lang, she already said na, oh my gosh, ang laki. Tinawagan niya agad yung surgeon. So, dinescribe niya dun sa surgeon what the lump felt like. So, movable naman siya, which is usually a good sign. Some lumps na may mga malignant tendencies tend to be really hard and immovable. Sa mga lumang mouse before, merong ball sa loob. So, it's kind of like that kasi you can move it around. Inisyuhan agad ako na mag-undergo ng mga procedures and tests so I can be fit for surgery. On that same day, I was asked to get my ProTime, CBC, ECG, MRI, and X-ray. So, lots of procedures, lots of poking and pricking, and just dun pa lang, sobra na yung anxiety ko. So, bumalik ako sa St. Luke's the next day. And then, the surgeon did insist na parang remove it. Kasi parang it even feels like, to them, it feels like dun sa ultrasound, it's bigger pa. They really wouldn't tell me or give me like a straight answer if it's benign. They would say na meron siyang benign characteristics and they would say na, oh, it's kind of good na yung texture niya and this is how it looks like sa ultrasound, but just to be 100% sure, we have to remove it so we can get it checked sa biopsy. Our family does have a history of breast cancer. My aunts have them, so dun ako parang medyo kinabahan talaga kasi your risk is higher if it does run in the family. I got all of the procedures done in the next couple of days. Pabalik-balik ako sa hospital. Pinaka least favorite ko talaga was the MRI because they had to stick in an IV sa ugat mo, and that was one of the most painful IVs that I've experienced. Super uncomfortable also, and kailangan nakadapa ka sa loob ng MRI. You have to stay there for 40. Nagtagal ako almost 2 hours kasi I kept moving. But the nurses and the doctors naman sa St. Luke's, they were very accommodating and they were very nice. And they made the whole experience a lot better. They would talk you through everything. And kaya sobrang hands down talaga ako sa mga doctors and nurses and all the medical staff. It really helps na yung people around you do show empathy. Si Doc, sobrang nice niya talaga, as in, he knew exactly how I felt na I would be super anxious about this, so he immediately got me the nearest possible surgery date. and tinawagan niya lahat ng mga contacts niya, his friends, and yun, parang he insisted na I do get this surgery as soon as possible. Punta agad ako sa mga different procedures, and it was pretty quick, except for the MRI, which I had to be at the hospital ng 4 a.m. And then even 3 hours before that, so I was there ng 1 a.m. and I had to wait until 4 a.m. 1 a.m. because I had to get my creatinine, so they had to make sure na my kidneys were healthy enough para okay ako pasukan ng contrast. So waiting game na, I had to wait for the results of the MRI, and as I was waiting at home, I got COVID. Ano ba? Ay, Lord, help me. Help us. And it was just really, really bad. You're already going through this anxiety, the pains of the picking and booking and going in and out of the hospital, tapos you get COVID pa. Pero you know what? The timing is impeccable. The day that I got COVID, parang if you would count it down, I got healed and I recovered from it exactly a few days just before my surgery, which made it safe. And even a few days before I had to go to the hospital to get my pre-surgery briefing, nag-flow naman siya smoothly. I got runny nose, konting cough. Hello, it's me Lottie and I'm editing right now, and I just forgot to mention na nilagnat din ako na nag-range from 38 to 39. And then I also felt mga extreme body pains from my legs. Parang umaakit kasi siya, legs to arms and then to my head. And pretty much lasted for 2 days. And then on the 3rd day, medyo umokay-okay na ako. I had my taste the whole time, so buti na lang. I kept on doing research, which I shouldn't have been doing. But most of all, I just kept praying. I laid it all to God, and then I cried to Him, asking God to heal me from this. Lots of tears in my room, and I'm just so grateful with my parents because they were just there since day one. The day before the surgery, I was just panicking and sobra yung anxiety ko. I was so scared about anesthesia. Pinasukan nila ako ng IV. Even my surgeon also said, this is something na kinatakutan ko, is he said na usually if super laki ng mass, tinutuloy niya ng tanggalin yung whole boob. Parang diretsong mastectomy na kasi nagde-deflate usually yung boobs and wala na talaga matitira if the mass is so big. So every time nakakapain ko yung boobs ko, ganito kasi kalaki siya. So parang almost half of my whole boob. And I was so scared na baka mamaya pagising ko sa surgery, wala na akong boobs kasi tinanggal na. But my top priority was for the mass to be benign. So that was my main prayer. My surgeon wanted me to be asleep during the surgery kasi may mga times daw na kapag local anesthesia, you would feel yung pressure, and medyo traumatizing siya for some patients, especially me because I am diagnosed with anxiety along with my ADHD. So pinatulog na agad ako. Nalimutan ko pala ikwento yung mismong pagpapatulog, but basically merong another doctor inside the operating room. She was the anesthetist, and her job was to administer the anesthesia and make sure na everything dun sa operation would flow smoothly. So she was very accommodating and she's very sweet naman. So I asked her, Doc, paano po ba ako makakatulog? And then she said na, yun na, start na. Kasi apparently, nakapasok na pala yung IV and the fluids are already running in my veins. And I didn't even remember blinking or parang closing my eyes. Ang naalala ko lang is, umikot yung paningin ko and then, poof, I'm awake again. So, yun nga, like I mentioned, para siyang time travel. Also, what I really loved about the anesthetist kay Doc is she did not intubate me anymore. Parang I was fully expecting to be intubated kasi you know, when you are under anesthesia, usually you can't really breathe on your own, but she mentioned something about my airways being parang clear naman daw or something like that, and then gas na lang yung binigay niya sa akin, so I didn't have to be intubated. I was scared of that because usually when you're intubated, you'll feel sore sa throat mo when you wake up. But yeah, that's pretty much it. The next thing you know, they were waking me up and tapos na yung surgery. Para kang nag-time travel, and to be honest, the anxiety that you would feel before the surgery, not worth it kasi it just went super smooth. And I was an outpatient also. You just had to make sure na merong magdadrive sa'yo. You're not allowed to drive. So medyo sore yung boob ko during that time. As I'm recording this, it's Tuesday yata. I had my surgery Saturday. The next day, I already went to church. I thank God for everything, for the success of the surgery, for healing me from COVID, and praying that I do get results na benign. I waited until today and I got my results. It shows fibrocystic characteristics. So in short, it's benign. Thank God for that, and I'm just so grateful for him kasi even my period, you guys, TMI, but I get pretty bad periods, and I wasn't supposed to get my period until on the day of my surgery, pero I got it days ahead. So on the day of my surgery, 4th day ko na siya, and I didn't have to suffer. Lahat yun ng sabay-sabay. Tapos it was weird kasi after my surgery, tsaka bumalik yung period ko. So parang, I don't know, everything was just orchestrated perfectly to accommodate this little blip in my life. This Saturday, I will get my stitches removed. Buti na lang din they put waterproof parang bandage over it. So I didn't have to do any wound cleansing. Nakaligo pa rin ako. But I wanna assure you na almost 80% ng mga breast lumps ay benign. The causes could vary from hormones to diet. Period can affect it. So make sure na you get it checked. Every lump, everything new that you find out, always get it checked by the doctor. And another thing na very important in this whole journey was my insurance. Sagot nila lahat. Everything from yung MRI pa lang ha. MRI would cost you around 20,000 pesos. The x-rays and all the different ECGs, more or less 10K. Operation itself, doctor's fees, 50, 40K. Everything could have ranged from 80,000 to 100,000. Sagot siya lahat ng health card ko. And this is for St. Luke's PGC, so one of the top hospitals. And I know, not everyone is privileged enough to have this kind of healthcare. This is why I want to advise everyone na do invest in your emergency funds and your insurance. And your health insurance and your health cards are very, very, very important. You would think na parang pag gumastos ka sa health card and insurance mo, it's wasting away money. No. One emergency thing could cost you so much more if you're not prepared for this. Totoo talaga na sobrang mahal magkasakit, and if it weren't for my insurance, baka lalo akong very important. Get your parents' health cards, get yourself a health card, make sure na you are covered. I personally would give God all the glory for all the healing that He's done for me and my family. It wasn't just me who's sick, by the way. My mom also got sick. Something about her nerves. No matter how young you think you are, check your breasts. How do you check it? Just feel around it, cup it. If you feel na may mga bumps or lumps or anything na parang hindi normal, already seek your OBGYN. I can make a part 2 if there are any more questions in this video. But right now, I just want to get this story out there for awareness. That's it. Thanks for watching. God bless all of you. Bye for now.